1300 WMEL.
The views expressed on the following program are those of the hosts, callers, and guests, and are not necessarily those of WMEL staff, management, or advertisers.
This is Joe Steckler, folks, your host for Helping Seniors, the radio arm of Helping Seniors of Brevard County. We have radio, TV, newspaper, YouTube, Twitter, Facebook, all the social media. We're expanding. Our purpose is to inform, educate, and connect people with resources, especially seniors and those that care for seniors. I like to mention our sponsors for this first part of the show, and that includes Gentiva Home Health Care, the Eye Institute, Solid Bite Dental Implants, Bill Johnson, Elder Attorney, WMEL AM 1300, this radio station, Wuesthoff Hospital Systems, Levin Home Care, Ren Care Medical Alert. And folks, those of us that are older, and you're a little decrepit, and you're in danger of falling, if you don't either have a cane, a rollator, or a medical alert button, excuse me, but you're being dumb. You need to have some kind of support so that you know you can take care of yourself. Ren Care helps do that. And Atlantic Shores Rehabilitation Center, and a brand new social daycare opening up down in Palm Bay. And I think they're having their opening next week. It's called The Social. I'll give you their phone number on the second part of the show. But it's a whole new concept in daycare. I started the Alzheimer's program daycares over on Wickham Road down in Mickle and up in Titusville years ago. The Social Club is a step up. It really is. The guy has put some thought into what he's doing. He's making an entertainment center for seniors, and he's licensed to take care of 78 people. And, folks, that's the largest daycare in Brevard County, 78 people. So you might think about that. The phone number to call here at the radio station, you have a question for Dr. Lenoci, a podiatrist, and me today, is 631-1300. 631-1300. If you want to call the office over and talk to Kay, the information specialist, that phone number is 473-7770. 473-7770. But now to today's show. We're going to talk about your feet and my feet and the feet of your loved ones, the feet of your neighbors, whoever feet you see. We're going to talk about that because the subject today is podiatry care, and my guest panelist is Dr. Lenoci. And Dr. Lenoci, where is your practice?
Thank you, Joe. I'm practicing with Osler Medical in Melbourne, Florida.
I'm sorry, I came a little guard. Say it again.
I'm with Osler Medical.
Okay.
In Melbourne.
And is your office down in the big building, or where is your office?
Yeah, we're down on US 1. It's 2222 South Harbor City Boulevard, just a little bit south of 192.
So if somebody hears you say something good and interesting on this show today, and I'll even ask you about how kind of shots do you give for when you take part of a toenail out. If you can do that without hurting somebody, that people need to know your phone number. So why don't you give them your phone number now?
Yeah, thanks, Joe. The number is 321-725-5050.
721.
Or 321.
321.
725-5050.
5050. Folks, and today we haven't had too many podiatry shows over the years. So if you have a question, and you don't even have to give your name. If you've got horrible toes and you want to ask a question about those horrible toes, you can call Dr. Lenoci, and he won't even know if you ever come in to see him just by talking to her phone. It's a joke, but seriously, he's here. If you have a question, you can call, and there's no strings attached. Dr. Lenoci, a general question a lot of people have about podiatry and foot care. How about just a short, general discussion of what podiatry is and what it can do to help people, especially seniors?
Well, podiatry is the medical, physical, and in some cases surgical management of any problem that relates to the foot or the ankle, and it's a wide range. lots of people have similar problems. Some people have problems which are quite unique.
Can you give an example?
Well, like you said earlier, one of the most common things that we see and treat is chronically infected ingrown nails. That's something which helps or happens to many people, and it's very treatable, and that's something which a lot of people can relate to. Another very common thing that we see is people's arches will start to fall over time, and as that happens, it makes the foot unstable, leads to arthritic changes, and that causes pain. And that brings a lot of people into the office.
How about people that, as we get older, your ankle starts to give way and it appears like your foot is starting to turn to the inside more so than the outside? Is that correct?
That's correct.
Why does that happen, and is there some remedy for that?
Well, the technical term for that is called posterior tibial tendon dysfunction. And what happens is that the posterior tibial tendon runs along the leg across the inside of the ankle into the foot, and its job is to support the ankle and the arch of the foot. And over time, for a wide variety of reasons, and the primary being just wear and tear, that tendon will begin to tear. And as it tears, it loses its strength, and the ankle begins to collapse inward. And as the ankle collapses, the foot then collapses as well, and then the arch will start to fall. And that's a process that can occur slowly over time, or it can sometimes happen quite rapidly.
What can you do? Can you do something to lessen the degree of turning? Okay, what can you do?
Well, it's like almost anything else. The earlier you catch things, the better the prognosis. And if you can catch it early, then you can provide support to the structure of the foot and the ankle by wearing primarily better shoes, more supportive shoes. And then we can add to the shoe. We can add an insert to support the arch of the foot. We can add a brace for the ankle, a combination of the two. And in a lot of instances, that restores function. It eliminates a lot of pain. And it really will slow down this progression of this collapse of the structure.
You know, you're a podiatrist, but think about general practitioners of medicine, our primary care physicians. Let's start at the head. We have a tooth problem. We go see the dentist. If it's more than a simple tooth problem, we have to go see a periodontist. We go to our primary care doctor, and he listens to our chest, listens to our back, looks at our throat, looks at our ears, takes our temperature. They might do an x-ray of the chest. They sometimes take that little, all those stainless steel tools out and thump you on the knee or someplace else, or take a tuning fork and check your legs for your vascular maybe vascular problems. But how many times do doctors check ankles and feet?
Yeah, well, I can't really. I don't know. It's probably not very often. Yeah,
but couldn't we do a much better job of providing for potential problems in the future, especially balance? Our legs, as we get older and our balance system starts to deteriorate, whether it's caused by muscle tone or the inner ear function or anything, we still get wobbly on our feet. And if our feet are not capable of supporting us, we've got a problem we've been sort of building up on from 21 or 22 years on up to 81 or 82.
Right.
we could do better.
Yeah. The foot is the foundation, and once that foundation becomes unstable, then bad things can start to happen. Right.
But as a podiatrist, do podiatrists as a collective group, are there any written directives out or books or information on podiatry care that stresses the importance of feet examinations as it would be with an overall body examination? Does that exist?
Well, certainly the American Podiatric Medical Association pushes for that. They have a website. They have marketing. As a general outreach, it's probably not there as much as maybe it ought to be. Where it's definitely there is in the diabetic population. And the American Diabetes Association recommends an annual foot exam for all diabetics. Virtually every managed care plan has it in as a bullet point, which needs to be done in the new Affordable Care Act. It's a bullet point that it needs to be done. It's a standard benefit for diabetics.
Wait a minute. Are you saying under the Affordable Care Act there's some special information there about foot care?
It's a standard benefit. It's recognized for diabetics. And so I'd have to say that's a good thing. That's a very good thing, and it's been there. It's been in existence for a long time. Medicare has recognized diabetic foot care as an extremely important way to preserve diabetic feet and limbs, and that's an ongoing program. It's very viable. Virtually every medical physician is aware of it, and most thorough medical physicians will refer their diabetic patients for an annual exam, and then we try to get them into an ongoing routine program where we maintain them and monitor them.
If I ask you a question, and the question would be this: Dr. Lenoci, how many people listening to you and me talk today would actually realize that if they're 65 or older, they can go to a podiatrist and have the podiatrist trim their toenails under Medicare? It won't cost them a cent.
Well, I'm not sure that applies to all seniors. And it's frustrating. It's very frustrating because many individuals in that group need that. It's hard to reach your nails. Nails tend to get thick over time. And it should be a benefit available to all seniors under Medicare.
Well, I just found out it is. It is a benefit.
If you qualify under certain medical diagnoses, it is a benefit.
Okay, I qualify. I'm 81, but I wasn't aware. I saw a podiatrist, and he said, Joe, you can come in every 6 weeks and get your toenails trimmed. And he said, it's under Medicare. He says, in your case, he said, you can do that.
And I'm not privy to your medical history, but
I had a stroke.
Yes, and that would be on the list.
Oh, okay.
That would be on the list.
That's
and the list generally tries to identify patients who are at risk otherwise for infection, right?
Okay.
And
makes sense.
And that would be patients with peripheral vascular disease. Certainly if you've had a stroke, then you have peripheral vascular disease. The two go hand in hand.
Okay.
Diabetics, there's a whole host of peripheral neuropathies, which place people at greater risk. And this is all spelled out in the Medicare guidelines. And so that helps a lot of people. But that does leave a void of a number of Medicare-aged patients who still need the care because they can't do it themselves, but they don't have a diagnosis which falls on that list. And in which case it's just not a Medicare-covered benefit.
I'll make you a bet, though. I'll make you a bet that most of the people listening to this show today, if you think about your own care situation and what you do with your doctor, a lot of us may qualify for that service. And by listening to the two of us talk about it on this show today, it may open up a whole new area of treatment they can receive that will help them. My danger in cutting my own toenails is I'm not sure if I've got the nail or a piece of my toe.
Correct.
It gets to the point where you get stiff, you can't get down, or you can't get your foot up, and you don't know exactly what you're cutting. And if you're diabetic, and so many seniors are diabetic, you can do dumb things that could cause an infection and just exacerbate the diabetes problem. And when I had come into the Navy home, one of the biggest things I saw from seniors, one of the biggest dangers in foot care were ulcers on the feet that were not treated and not detected early on so that they could be properly treated. And I saw several amputations occur simply because the patient didn't make the problem known to the doctor.
That's right, yeah. And it's a big problem. It's a big problem. And Medicare recognizes that.
What, as a podiatrist, what kind of significance can you attach to treatment, foot care treatment for younger people as opposed to older people? Importance, what we should do, how should we try to improve the care of our feet as we go from young to old?
Well, like most everything in life, problems start early and get worse later on. And as a young person, the better you can care for your foot, the lesser chance of arthritic changes later on. And again, it goes back primarily to shoes. And sometimes it just has to do with someone just has bad luck. You might have an injury, and that makes one joint or another joint of the foot unstable. And then you have a choice. Your choice could be to modify some of your activities, maybe change the type of shoe you're using, or to ignore it and just continue the wear and tear to the point where parts wear out. And
I know that a couple of the areas that you had wanted to discuss on the show included the subject of exercise and overuse induced pain in the feet. And I think that sort of ties in with what you're talking about right now, doesn't it?
To a great degree, yeah. And a lot of the complaints that we hear in the office really tie into that, and people just come in, their feet hurt, and then you start talking to them, and you try to get a sense of what they may or may not be doing, which is contributing to that problem.
How many people, well, I guess it's not fair to say that. A thing that I have heard mentioned many times by people that stub their toes. I've heard a lot of people say, well, I broke my little toe, but there's nothing I can do about it. And is that true?
Most of the time, yes. It depends upon whether or not the toe's pointed in the right direction. Yeah, sometimes people will break a toe, and it's pointing off in left field somewhere, and that's generally not something which someone would want to live with for the rest of their life. And for an instance like that, we would reset, or recommend at least that we reset the toe.
You can't splint a toe, though, can you?
You can sort of tape one toe to the toe next to it.
Okay,
kind of use that as, yeah. Okay. And it sort of stabilizes it to one degree, providing that the toe next to it is a straight toe. And so again, it's good luck, bad luck. But it's generally worth it to x-ray an injured toe just to look at the alignment of the break, and 95% of the time we'll say, look at it, just got to let it heal.
See, I think a lot of people have a tendency to hurt their feet, and because it's not going to be seen, it's going to be covered by a shoe, they tend to overlook it. The other night, I got up and got out of bed, I had to go to the bathroom, and I when I get up at night, because of my balance, I sense I have a problem, so I use a rollator, not my cane. I keep a rollator by the bed. And I don't know how I did it, but I hit the wheel with the little toe on my right foot. It hurt like heck. I was afraid to look at it when I went into the bathroom, but it was okay, and I didn't break it because the next day I wiggled it, it still moved, so I knew I hadn't broken a toe. But there are a lot of people, I think, that suffer injuries to their ankles and to their feet that need to call a podiatrist and go in and take a look at it. Because I think that just in my own exercise of care of my body through 81 years, that I have probably been less concerned about my feet than any other part of my body. And I think that's been a dumb thing for me to do. And I would like, after people listen to you talk today, they would be more concerned about the health of their feet, because there are other things. When you talked about use-induced pain, what do you mean by that?
Well, it kind of ties into what you were just saying. It's many people will have a tendency of just trying to push through the pain, right? Yeah. They might be, my foot hurts when I do this or when I do that, but I'm going to do it anyway. And sometimes you have to do these things. There's certain things in life which are mandatory, but there's lots of other things in life which are more optional. And some people just are determined that they're going to wear whatever shoe or do whatever activity and just deal with the pain. And generally speaking, that doesn't end very well.
Okay. I'm getting this signal. We're going to take our mid-show break here, folks. We'll take about a 2.5-minute break. We're going to come back. I've still got about 5 pointed questions I want to ask Dr. Lenoci. So stay with us. If you have a question, you can call us at 631-1300. 631-1300. Stay with us.
AM 1300 WMEL.
This is Joe Steckler, folks. We're back live with the second half of the show today with Dr. Lenoci, a podiatrist. Before we get back to our show, I'd like to mention a couple of phone numbers. The phone number here for the radio station, 631-1300. And, folks, if we haven't stirred your attention up to ask a question in the first part of the show, I guess that we're going to talk about on the second half of the show. You might want to call next week and say, why did you ever talk about that, Joe? But anyway, we're going to talk about something that's new that, it's probably old, but it's not discussed very often. But the phone number for our office is 473-7770. You can reach Kay if you got a question for her over there as a result of what you hear today. Or if you need Dr. Lenoci's phone number, call Kay. She's got it. The sponsors for the second half of the show today include Senior Scene Magazine, and we're getting ready to come out with a new article there in Senior Scene. Hometown News, we got a new article in Hometown News. Spotlight Magazine, a new article in Spotlight Magazine. Seniors Helping Seniors Home Care, the Fountains of Melbourne. Beth Courtney with the Braswell Courtney team, financial planners. Kenneth Chiropractic, Canadian Meds of Melbourne. Wiederman Malik Attorneys, and Vitas Hospice, and the Social Club. So what we're doing is building a senior care network that if you call Kay and ask her for a recommendation on where to go for help, I can assure you that the people that are our sponsors will be people that will provide you a fair service at a decent price. Everybody has to get paid for service. Now, having said that, I could read you some testimonials where some of our service providers have done free care for people that simply can't afford it. A good example is that we had a call the other day from a lady. Her total income was $8,640 a year. Her dentures were broken in half. They could not be glued together. They couldn't be fixed. She needs new dentures. But due to the bone loss in her mouth, she needs implants to hold the dentures in place. The procedure would have cost more than a woman earned in a whole year. Now, we run across stuff like that. We work with doctors, with dentists, and in one case, we were able to help a man who could not eat because his dentures wouldn't stay in place, a doctor actually did a new set of uppers and lowers for us for $350. Now, there are caring doctors, caring dentists, and all kinds of medical people out there that do their very, very best. And as long as they can afford to do some of these things for people that are nice, and people that just can't get the kind of help they need, bring those problems to Kay's attention by calling her 473-7770. And I'm not going to sit here on this radio station and tell you we will solve all the problems. We can't do that. But I can tell you this. If you don't tell us what the problems are, you stand no chance to get any kind of help at all. And believe me, there is a lot of help out there. And as we work forward here at the radio station, we are trying to put together and get WMEL branded as an elder-friendly radio station. Now, all this stuff costs money. I don't take any pay. I'm very proud that I don't have to do that, but other people that work in the system do have to be paid, and they've got to earn a living. So think about what I'm saying, and if you want to participate, be one of our sponsors, one of our helpers, call Kay at the office at 473-770, because working together, we can make a lot of things happen. And if you read Hometown News, Senior Scene Magazine, go to our website, helpingseniors.org, look at what's available for you. Be part of the movement. So that's enough said. Dr. Lenoci, you made an interesting comment during the break, and I'm going to talk about it before I get back asking other questions. When I had command of the Navy home at Gulfport, Mississippi, my last Navy job, one of the biggest podiatry problems I saw there were foot ulcers that were left untreated, and as a result, a number of amputations occurred. And once I saw what was happening, we started then requiring all of our residents to have routine feet examinations. And that helped a lot. But you several times have made a point that all this care has to start early on in a person's life, right?
It's always best, yeah.
Yeah. But your wife mentioned something that I never thought about. But, the use of worms and maggots is something that's been around the medical field for years, hasn't it?
It's been recognized for probably as long as humans have been alive. People have seen chronic wounds that have maggots in them. And if you read accounts of the Civil War, there's many accounts of nasty wounds which were just completely cleaned out by maggots that were picked up in the field. And over the years, a certain segment of the medical population has continued that practice in certain wounds, and maggots continue to this day to be used from time to time.
As long as we can talk about medical marijuana, and we're not going to talk about that on the show, but I really would like for you to be a little more explicit about the use of maggots in treating foot diseases.
Well, and I should qualify this. Our group, Osler Medical, became a part of the Wuesthoff system a few years back, and since that time, most of our chronic ulcers go to the Wuesthoff Wound Care Center. They run an excellent wound care center. They do a great job, and they can manage a lot of these problems far better than we can in the office, and we routinely use them. But historically, and still from time to time, we'll come across a wound which needs to be cleaned out, and maybe in the foot, there's not a lot of muscle, there's not a lot of fat, and some of these ulcers, they're right around tendons, arteries, nerves, and if we tried to go in there surgically and clean this out, we would sacrifice some of these structures which we might not otherwise want to sacrifice.
Right.
And in these instances, it's oftentimes very useful to implant medical grade maggots, and there's one company in the whole country. There's only one company. They're out of California, And they grow these, and they grow them in an environment which is monitored, it's clean, and they've got all sorts of certifications by the government. And you can order them. They come in next day air, and they show up in a little vial, and we take them, and there's a certain technique we use, and we put them in a wound, and they'll start off about the size of maybe a half a grain of rice, and in a few days they're about a quarter of an inch, half an inch large. And they just go in, they eat out all the dead tissue, they do a great job, and then we flush them out in 3 or 4 days, and the wound has a nice clean bed, and we continue the wound care at that point.
Is something like that painful?
I'm told that if you don't have neuropathy, and again, a lot of ulcers are in the presence of neuropathy, particularly diabetics. So the lack of pain sensation is a component to the development of the ulcer a lot of times. So, but there are still some patients who get an ulcer who don't have neuropathy. And some of the reports are that they can feel the maggots in the wound. Maybe it might, particularly if they're around a nerve, perhaps, right?
Okay.
They might get some tingling. They might feel a little pressure, a little movement. So it's a select group of patients and a select group of ulcers which may or may not benefit from maggot therapy. But it's a very viable alternative for some people. And
one of the reasons I wanted to talk about it so much was that you mentioned in talking, I didn't tell you why, but they have, at the Wuesthoff Wound Care Center, they have the hyperbaric chamber there. And they can do a lot with the hyperbaric chamber today. But people don't realize that hyperbaric chamber started out in decompression of divers years ago. And I was the executive officer on a submarine tender in Norfolk, Virginia. And we had 2 cases where a guy tried to commit suicide, took himself, put him in the air chamber over at the Naval Air Station, and took himself up to about 100,000 feet and decompressed rapidly. And we got him into the hyperbaric chamber. Saved his life. But we also had another man that had an infection in an arm and needed an amputation. And we did an amputation in a submarine tender decompression chamber, and this was in 1972. So, you know, there are things that common things that happen, but until they're talked about or shown on TV or pop up on the internet somehow, and that's one of the things I like. You asked me earlier if I looked on the internet. I find so many things that are interesting on the internet that talk about medicines and medical treatments. And then when your wife mentioned the business of the maggots, I thought, this is so important because so many people are afraid of shots. Mm-hmm. I mentioned to Dr. Lenoci that I'd had to have an ingrown toenail taken.
Ingrown
But
toenail,
it was really where they had to slit a nail all the way back into the quick. And that's painful. That is extremely painful. But the podiatrist that did it for me had a needle that was about 4 or 5 inches long, and it was just as skinny as I can already see the darn thing. But it went into my toe, and I hardly felt it. I just watched it go around my toe. And when he did the surgical procedure, I didn't feel a thing, doctor.
Right.
I did not feel a thing. And I think people need to know more about foot care, what surgery can be done to make us walk easier, walk without pain. There are things that we subject our bodies to we don't have to.
Right. Well, here's the thing. Virtually any foot problem that you can put in front of me has a theoretical surgical solution. And I've been doing this now since 1989. When I first came out of training, I had all this surgical training, and everything looked like surgery. And over the years, I've gone 180 degrees from that, and nobody really wants surgery. No one's got the time for that, and then there's risk with surgery. But there are certain surgeries which are very worthwhile to do. And in that particular procedure you talked about, the ingrown nail infections, very worthwhile surgery to do. We do them all the time. Typically, our procedure days are Fridays, and we'll do 7 or 8 patients almost every Friday with that procedure. It's a very rewarding procedure. Other procedures which are somewhat rewarding, sometimes people will have a very, very painful crooked toe, for example. They're very limited in their shoes they can wear. Maybe they can't wear shoes at all. And oftentimes it's rewarding to fix that problem surgically. Sometimes people will have an injury. Usually it might start, for example, an injury to the great toe joint. It's a very common injury, happens to athletes. And a lot of times it's something you ignore, right? You walk it off, but that destabilizes that joint. And over time, that joint develops arthritis. And this is a problem which has happened to many professional athletes. Shaquille O'Neal, one of the things that tormented him towards the end of his career was an arthritic great toe joint. And Dick Butkus ended his career. And so the list goes on. And it's a debilitating problem because you need that big toe joint to walk comfortably. And oftentimes that's a rewarding procedure. Now, the problem is the recovery. And so sometimes that works for people, sometimes it doesn't. But so there's always a surgical discussion, but more often than not, people find ways to live with problems and maybe change their shoes, maybe change their activities, find a different way to exercise, and it just become more comfortable, but still functional.
But I think I've tried to pay attention to what you're saying from the first to the second part of the show, but I sense that an important thing or an outcome that could come of failure to treat some of these problems is that if you have an injury to a toe and you don't take care of that injury, how about the adjacent toes? How does the presence of an injury in one toe magnify itself in the other toes if you don't properly treat? Now I'm talking about structure, fractures, maybe arthritis, something like that.
Well, it's really the foot in general. The most important toe you have is the big toe.
Okay.
And when you walk, 1.5 to 2 times body weight of pressure will go through that big toe joint. Now, if that big toe joint is injured, it doesn't bend as well, it's arthritic, that force is then going to be distributed across the rest of the foot. Those bones are not designed to take that type of stress and strain,
okay.
And that will put undue stress on those structures and generally leads to chronic pain and arthritis. But what happens with the rest of the foot is the foot's just one giant mechanical device. It's not at all dissimilar to your car's front end alignment. You know, your alignment can be off in your car's front end, and you can keep driving. But if you do, you're going to wear parts out.
It's hard on the tires.
And it's hard on the entire steering structure, right? And that's what happens to the foot. If you injure it, if the foot just becomes unstable, like you talked earlier, that the posterior tibial tendon dysfunction, where the ankle starts to roll in, the arch starts to roll in, one deviation then puts stress and strain on an adjacent structure, and then after a while, it's like you're driving your body out of alignment, and that leads to wear and tear, and that leads to arthritis, and it's manageable, right? It's manageable. You're not typically going to go in and surgically reconstruct the foot, although you could, but we generally don't. But we would recommend better shoes, better arch supports, maybe change the way you're exercising, right? You don't necessarily have to walk for exercise. Maybe you can ride a stationary bike, and that's certainly much easier on the musculoskeletal system. Yeah.
Let's talk in the few minutes we have left about some general old podiatry problems. Smelly feet, athlete's foot,
heel pain,
What kind?
Heel pain, arch pain, plantar fasciitis,
arch
right?
pain.
Very
That's
common.
a good one to
very
start.
common.
Let's start with the arch pain.
Well, and it goes back to an unstable foot. The human foot has not necessarily evolved to be able to withstand concrete surfaces. And that puts a lot of stress and strain on the foot if you don't have proper support in your shoes. And a classic example of that is several years ago, this craze started of this lightweight running shoe. You've seen these. People were running barefoot. They were running with shoes which were featherweight, and books came out. And of course, as predicted, 5 or 6 years later, all these runners have injuries, and they're all back to standard running shoe. Same thing with the human foot, right? If you're going to go to the flea market and walk around for 5 hours in a pair of thin sandals with no support, chances are you're going to stress and strain your foot, and you're going to get arch pain, you're going to get heel pain. And once that starts, because you have to walk on your foot, it's awful difficult for your body to recover from that, and it becomes a vicious cycle. And, of course, the best treatment is to prevent it to begin with. But once it happens, then you have to look at how you might be contributing to that and what you might be able to change. Because if you keep doing the same thing over and over again, I think we all know that you can't really expect a different result, right?
Over the years, what have you observed to be some of the most effective treatments for athlete's foot?
Well, of course, you being an ex-military person or a former military person, the military has had a strong interest in this. As a matter of fact, many years ago, the military actually did a study to see if you could transfer athlete's foot from one person to another, and they took these soldiers who had terrible athlete's foot and made them soak their feet in this water, and then they took other soldiers without athlete's feet and made them soak in the same water to see if they would get athlete's foot, and they didn't. They did not. So there's a genetic predisposition. It has a lot to do with the shoes and socks you're wearing, right? The best way to manage it is to get plenty of air to your feet. There's topical antifungals, which are useful, but the problem's chronic. And it's managed but not necessarily cured. And oftentimes you'll get your skin to clear up, but if you get away from what's working, it's going to come back. And quite frequently, what's feeding your skin is actually the nails. And many, many people, especially seniors who have athlete's foot, actually have fungal infected nails. Those are those thick yellow nails which seniors tend to get. Those nails have fungus in them. And that fungus cannot be eradicated from a nail, but it will go from the nail into the skin. And just as a corollary to that, it's been clear to me that what's very important to you is to make sure that people don't take advantage of seniors. And there's a huge cottage industry out there as far as reported cures for fungal nails. And most of these are just not substantiated, and people can. There's a lot of people who are very happy to take your money to cure your fungal nails. What are some of the best?
If somebody wants to treat the fungus, I've heard it said that you have to take and put the medicine on top of the nail, and the nail has to become pliable enough for the medicine to work through the nail to get the other side. Without that, you talk about nail removal.
Well, the truth of the matter is that there's two medications which have FDA approval. The most common one that people have seen the commercials is Jublia.
Yeah.
But the fact of the matter is that even under best case scenarios, it's a 10-20% success rate. Topicals generally don't work that well. It's a matter of it's a difficult problem.
That's you're the second podiatrist I've heard say that some of these advertised things don't work so well.
You have to be very careful who you give your money to. Fungal nails are typically managed. If they're really a problem, it's best to remove the nail. The nails can be removed, and people don't really need a nail. Sometimes a nail gets to the point where it's causing more problems than it's worth. So
I think we're just about out of time, Dr. And I want to thank you very much. And I hope you, our guests, our listeners, have learned something from today. And you can always call us at the office to get Dr. Lenoci's phone number. And I want to thank you, Dr. Lenoci. And I thank you. His wife, Terry's been in the studio with us today. She came to check to make sure he didn't say anything wrong. But thank you, Terry, for being here. And thank you, Dr. Lenoci. And thank you, listeners, for listening. Have a great weekend. I'll see you next week. Bye-bye.